Hello all, I am Ruchismita Deb and I work as a product manager with Core Diagnostics. Today I'm going to speak about leukemia and one of its subtype, acute myeloid leukemia. So before we jump in to understand what is leukemia, let us first understand how blood cells are formed. Blood cells are formed in the bone marrow, the spongy tissue, which is located inside the bones and it contains young parent cell called stem cell. This particular cell gives rise to different type of blood cells. One is red blood cells. As we all know that blood is red in color, so this red blood cells imparts red color to the blood. And it also helps in transporting oxygen from lungs to different tissues. White blood cells, it helps us against any kind of infection and provides immunity. Platelets helps in clotting of blood. Now, have you thought if this particular cells becomes abnormal in nature, then what that condition will be called? That condition will be called as leukemia. So leukemia is a cancer that starts in the blood forming tissue such as bone marrow. This condition produces more number of immature white blood cells. Now, if you see the diagram, there's a clear differentiation between normal condition and leukemia condition. In the normal condition, the red blood cells are more in number, but in leukemia condition, the white blood cells are more in number, and these white blood cells are immature in nature, so they do not provide us protection against any infection. Now, leukemia is of different types. So today, let us speak about acute myeloid leukemia. AML is a type of cancer of the blood and bone marrow with excess immature white blood cells. Now, if I talk about the incidence of AML in India, 80% of adults have AML and 20% of children have AML. So, the average age of diagnosis of AML is 68 years. Now, let us understand the risk factors associated with AML. Now, what exactly is a risk factor? So risk factor increases the chances of having cancer. Some risk factors like smoking can be changed, but other risk factors like genetic disorders or family history cannot be changed. But having said that, if you have any of the risk factors, that does not mean that the patient will have cancer. Sometimes the patient without having any risk factor also develop cancer. So let us now see the risk factors associated with AML. Person having any genetic disorder like Down syndrome also have an increased chance of developing AML. Exposure to chemical is also one of the risk factor. A prolonged exposure to a chemical called as benzene, which is a solvent found in rubber industries, gasoline industries, also aids in developing AML. A person who is above the 60 years of age also has increased chances of developing cancer. Now, exposure to radiation. When a person is already exposed to any kind of radiation, for example, he is a survivor of a bomb blast or a nuclear reaction, also is a risk factor of AML. Now, other blood disorders like myelodysplastic syndrome can also further develop into AML. When it comes to gender, more men are more likely to develop AML as compared to women. Now, previous cancer treatment. So if a patient has already undergone cancer treatment with chemotherapy, drugs or radiation, they can also develop AML in the following years. Now, let us see the symptoms of AML. So as we know that in this condition of AML, the white blood cells are more in number and hence the red blood cells are less in number. So they do not transport oxygen in many of the tissues. And that is why there's a shortness of breath, fever, headache, fatigue, etc. Bone and joint pain is also one of the major symptoms of AML because the leukemic cells deposits in the bone and hence it leads to bone pain. So if you have any kind of symptoms, please reach out to a specialist and he or she will further guide you for the treatment. Now, having said that, symptoms of AML we have already seen. Now let us understand how do we diagnose AML. So the basic test, that is complete blood count, it tells us about the different blood count available in our body, whether it is RBC, WBC, or platelets. And specialized tests like flow cytometry, fluorescence in situ hybridization, that is FISH, or PCR also helps in diagnosis and prognosis of AML. So if you have any symptoms, please reach out to the clinician and he or she will guide you to further diagnose AML and also will guide you for the treatment of AML. If you have any questions, please reach out to us at productmanagementcodiagnostics.in. Thank you.